365, no sleep. Wake up. 365, no sleep. Wake up.
Welcome to another edition of Gain and Retain 365, where our goal is to educate and motivate aspiring entrepreneurs. Today we have two very important guests. I will allow them to introduce themselves.
Hi everyone, I am Ashley White.
Hello, I'm Shoni Adams.
How y'all doing today?
Pretty good. How about you?
Doing well.
I can't complain. It's a pleasure to be here with you all.
Yes, absolutely. We're glad to have you.
Oh yeah, man. Thank y'all for taking time out y'all schedule to do this. It's important.
Thank you.
Yeah.
Thank you.
Hey, and we're here, man, at Nu Leif. This is a beautiful establishment, man. I mean, I'm gonna have to give y'all a tour and let y'all see what it look like. It's amazing. It's amazing.
Thank you.
Curious guys, what motivated you all to start this business?
Well, I think what motivated us is we are registered nurses. I don't know if we got a chance to mention that or if you knew that. And we've spent a lot of years providing good care to a lot of people in a lot of different aspects in nursing. A lot of different facilities and a lot of different roles that both of us have got to embark upon. And one day we were having a discussion and we thought we would, come together and try to provide good care to people on our own terms.
Okay. So both of you all have a background in nursing.
Absolutely.
Okay. How many years for you?
So I have been in healthcare 15 years. We were just discussing that.
Wow.
This time has really
It's
flew
been
on by.
about 14 years for me.
Okay. So no stranger to the industry at all.
Correct.
Okay.
Like she said, we have been in multiple demographics within nursing.
Okay.
Mental health, just a lot of bedside, substance abuse clinics, long-term care facilities, as well as the acute care setting.
Okay.
And so, getting us started up, we were just thinking, do it on your own terms. We both have had a lot to offer to nursing, to healthcare, and to nursing, and to our community. So, we wanted to give back in a different way. And so, kind of within nursing, but like she said, on our own terms.
I like that. So what's the main goal for Nu Leif? Like, what's the main thing that you guys focus on here?
Well, I think our main goal is to put out good community work. And let me elaborate on that a little bit more. So as mentioned, we have a personal in-home care agency, and we have a proprietary school, so we can offer job training to those who need it in the community. And then we can also send good workers into your loved ones' homes to care for them. So it's almost a full circle approach.
Okay. So after training, you can place these individuals into the workforce. So put them into the work field.
Absolutely.
Okay. So it's pretty much A to Z here.
Correct. And there is no shortage of, we get that question a lot. Are you guys offering job placement? There is no shortage of jobs within the nursing field now. Actually, there is a shortage of staff.
Really?
And so this is a high demand field of work. So when we push you out, when we train you, when we push you out, you will be able to find a job. There is no shortage of jobs. But also, as my business partner was saying, we have a personal in-home care aspect of our business.
Okay.
So we have positions that we would want to fill as well. And
Absolutely.
so through those, as we teach individuals, if we decide they're a good fit for us, then we would likely place them with us if they wanted to be.
That's cool. But a lot of times you get training and then you're worrying about where am I going to work after I finish. You know what I mean?
Right.
And that's always a concern, which it should be. But if I can get my training here and then I know that Nu Leif is going to help me find employment, that would encourage me to come and be a part of this program.
Absolutely.
So for everyone listening, I know you guys provide CNA training.
Correct.
And what else do we offer here?
We offer CPR courses.
Okay, CPR.
We offer CPR for healthcare providers that have already been working in the industry and they just need to renew. And we also offer it for just lay people, somebody that is unbeknownst to the healthcare field.
Okay. Okay. Cool. And how long does the CNA program take?
So right now we're doing 3.5 weeks.
3.5 weeks. Okay. And then once they finish that, they can also test here. They can take their test here with you guys.
Correct.
Okay.
Correct.
And I know just something you was telling me about. Could one of you guys elaborate on that? How did you become a designated testing center? Because that's interesting to me.
Well, we have the background. So with that being said, we're registered nurses. We're registered nurses. So what we are for the Arkansas, to the appointed testing site facility for Arkansas, or the contractor, may I say that, is we are their RN observers.
Okay.
So people who are waiting to receive their certification. So let me step back a little bit. So you do a training program, and that's any certified nursing assistant program, and then you obtain a certificate.
Okay.
And then once you obtain that certificate, then you're eligible to test for the state to receive your certification. So CNAs actually receive a license. So prior to that, you are a nursing assistant. You're not certified yet, and you can work on that, and that's temporary. At that time, then you go test. And so what we offer here is we have that test is 2 parts. You do a knowledge test, and that's computerized, and then you also do a skills test. And so we are RN observers for the Arkansas testing facility. So you can come in here, you can take your computerized test, and you can sit down with one of us, and then we'll administer your skills test, and we kind of watch you run through what you've already been taught within your program.
Okay, quick question. So if you guys weren't registered nurses, would you be able to facilitate that?
To my knowledge, no, you have to be a registered nurse to observe.
Okay, cool. So what have you guys been doing to get the message out to the community about Nu Leif?
We have, of course, drawn from social media.
Okay.
We've been using social media. We're on Facebook and Instagram right now. We are in the process of getting our website to where we want it. So we're doing some editing. Actually, this week we're hoping to have it pushed out there. But also we've been out in the community.
I've seen that.
Yes.
Yeah.
So just connecting with different entities that might help people to, if they can't afford to come through classes, help them, pay for those things.
Okay.
Just a lot of outreach, just letting everybody know that we're here.
I like that. So could one of you all just touch on the potential that this particular industry has? You know what I mean? A lot of people know there's money in the medical field.
Absolutely.
But especially like right now during these times, like could you elaborate on how much potential it is even to go be a CNA?
The last research I checked on it, there were maybe over 100,000 positions needed for just certified nursing assistants. And that's within the next 5 to 10 years, and it'll probably be more than that because you have people who have been working in this role, and it's not just CNAs, it's anybody in healthcare. Eventually, we all age and we get ready to retire. We want to retire, we want to sit down. Not only that, a lot of people don't know there was a shortage in healthcare. There's probably been a shortage for about 20 years in just different aspects, including nursing. Certified nursing assistant is a good way to gain experience if you want to go further within your career, and that could be anything from you want to be a nurse to a doctor. It's a good way to get a feel of if you really have a heart for taking care of people, and if that's what you want to dedicate your career to do.
Absolutely.
Wow. So what are some of the requirements that comes with being a CNA? Could you elaborate on that a little bit?
You want me to take that one, or?
Sure.
Well, the requirement to enroll with us, and I want to say this is pretty consistent with most training programs, at least 16 years of age. You need to be up to date on your immunizations. You'll need a TB skin test. There is not a requirement that you have a high school diploma. However, it would be nice to, have a high school diploma or a GED, but it's, again, let me state it's not a
Not
requirement.
mandatory. Okay.
And you would have to check with Arkansas, the Office of Long-Term Care, in the event that you have a background or anything on your background. You would have to check with them to see if that excludes you. But other than that, you come in, you sign up, and you provide your documentation, and you're ready to enroll and start classes.
Okay. And then upon finishing class, right, they can test here. As long as they pass, then we can look towards job placement, right?
Correct.
So, and as far as that process, how does that go?
The testing process.
Well, not exactly the testing process, but the job placement. Like you said
Job
earlier,
placement.
if they're a good fit for this particular establishment, your business, then you see about putting them into the work field.
So we don't want to limit our students to, becoming employed with us. We want to provide that opportunity. We want to let them know that opportunity is there, but we definitely don't want to limit them. Once they have finished the 3-week program and sat for their certification and obtained it, we would refer them to our affiliates, and we're affiliated with one specific nursing facility and hoping to be affiliated with others. Ashley and I have worked in many facilities here in Arkansas, and so we have, I wouldn't say we could exactly place them in that hospital or in that nursing facility, but we know people. So we've kept up good relationships over the years, and but as far as becoming employed with us, they would then, if they're a good fit, then fill out an application. We would interview them just like we would anybody else coming in, but we would have a sense of their character because they've been with us for 3 weeks plus.
Right.
So that's how that process would start.
Okay. And this job placement is like for people that need in-home care and stuff like that.
Correct. For people that need in-home care, we would start the process by seeing what their needs are. Going out, and one of us, since both of us are RNs, we would go out and assess them.
Okay.
And see what their needs are, see what their coverage is, and provide those services to them.
Okay. I want to piggyback off what you said a minute ago about good relationships that you guys established when you were in the field working as nurses, right?
Right.
And I just want people to understand how important it is to establish good relationships.
Absolutely.
Because you never know who you're going to cross paths
Who
with
you'll
again.
need again.
Right.
Yes, sir.
Yeah, that's important. And networking. I know you guys been doing a lot of networking.
A lot of it.
Yeah.
A lot of it. Besides trying to get, connections with payors who would kind of sponsor students who weren't able to afford, we've been reaching out to in shelters and other places within the community, just trying to get people to let them know that we're here, and let them know a little information about our program. And we've been reaching out to a lot of people.
That's good. So I'm curious, what all licenses and certificates are required to start this type of business? What all hoops did y'all have to go through to get this going?
So a lot of it is attained through the state of Arkansas. So primarily, with both aspects of the business, is through the Department of Health and Human Services.
Okay.
Except with the exception of the license that we have through Arkansas Department of Higher Education. So you apply to them to become a proprietary school, and so you have to submit an application. You have to submit your curriculum, your what I call your paperwork. They want to review, and then everything else pushes over to DHS. So we are licensed with the Personal In-Home Care Agency and the Office of Long-Term Care, and it's the same thing. It's a bunch of applications, a lot of back and forth communication, what you need to maybe correct or fix, and then a bunch of hurry up and wait. Is that
Absolutely.
nice
A lot of hurry up and wait.
impatience?
Okay.
Yeah.
Okay.
Being patient with the process, because Ashley and I traveled quite a bit in the past 2 years, and so it's been you know, we've been established for a year, but while we were traveling, we were doing certain things on the road, submitting certain applications. We get a moment to come back home, we rush and do this and do that, and it's been a long waiting game because we've been away from home.
Okay. Okay. So from beginning the process to where we're at now, about how long would y'all say it took?
See, I feel like if we said how long it took us, it wouldn't be fair to a person that's here.
I got you.
You see what I'm saying?
Since you guys were
Because
traveling.
we were traveling
Right,
and we
right.
did what we could while we could. And but I would say, you know, any process would probably take anywhere from a month, 2 months, you know, just because pushing it through. Now the regional testing site, it went pretty quick because we were here in the office. We were on it. We were, oh, you need this document, let's fill this out and send it back in.
Right.
And we had that, we were approved for that, was it about a week?
Yeah.
About a week, it took about a week for that.
Okay.
We became BLS instructors. We were out on the road while doing that, but we had a really, really awesome instructor to get us going for that. That process took us a few months, but just because we weren't in the position to complete the process. But when we were, it went by pretty quickly.
Okay.
Licensures, different things. It took some time,
Right.
but it's worth it.
Right.
It's worth it.
So I'm curious, what were some of the trials and tribulations that you guys dealt with to get to where we are right now that really stand out?
In every aspect that we do, we're trying to provide something to maybe people who can't really afford.
Mm-hmm.
So this would be like lower income. And that's from, you know, somebody who says, yes, I want to be a CNA, but they can't exactly pay the total cost of tuition. Or somebody whose mother or father, grandfather, et cetera, needs a little bit of help in the home, but they're on limited income and they can't afford to pay somebody privately. So I think a bunch of the challenges were getting in compliance because we want to contract with agencies that provide reimbursement to people who are low income. And so I think a big challenge was meeting some of those requirements, like, and you will get a chance to tour. I think a big one that we had is, you know, we really worked hard to provide a very nice looking space, and then we had someone come out from workforce and say, well, let's see your ADA compliant parking spots and your ADA compliant bathroom, and we're like, we don't have that.
Right.
You know, and we
we
have
didn't
worked
know
so
we
hard.
needed
Yeah, and we didn't know we needed it. And so a bunch of things, and might I say, we got that done in 4 days.
4 days.
We came back out and we got approved, and we were told that we were the fastest
That's
establishment
the
to do that.
I like
turnaround
that's
on that.
determination, though.
Yes.
I like that.
Yes.
But it's running into things that you didn't know necessarily you needed because you learn as you go
Yeah.
in this process.
Right.
Absolutely.
And so you have to be able to, you know, quickly adapt to things. And sometimes it gets frustrating,
Right.
but you know, you just keep going.
Yeah, I like that. Don't let any adversity hinder you from achieving your goals, man.
Absolutely.
But you learn through it all and you grow, you know. So moving forward, guys, what are some of your dreams, goals, and aspirations for Nu Leif? What's the 5-year goal for y'all?
5-year goal. Well, for me, I believe if we go as hard as we've been going consistently, I think we can more so oversee. Someone else put those people in place that we trust or that we have decided to take the torch on for us. And, you know, of course, still be hands-on and periodically check in, but I believe somebody else will be able to carry on the torch in our business.
What about you?
So 5 years from now, I'm really, really, really big, and I think we both are on like giving back, and no matter how big or small, I don't think there's a way that you can, when you give back, there's not an expectation of what you receive in return. But I think for me, I want to say that 5 years from now, I would love to, train good people or provide good care, and then somebody comes back to me and says, because I went through your establishment, now I was able to become a nurse, become a doctor. Now I'm able to be a teacher, or and that's the way, and that's the way that I want to give back. That's where I see us, and I see us like really pushing good people out in the community, and pushing them out and having people go out and do things the right way.
Yeah. For sure. I'm curious. Anyone that may have influenced you guys to get into this industry, to go down this path? Anyone that you look up to that inspired you?
Nurses over the years who believed in us, because we started out as CNAs. I started out as a CNA, and then I went on to become an LPN. Just somebody saying that you can do it. Just keep going. I would say generally, a handful of nurses that have been in my corner the whole time, because I can't tell Ashley's story, but I can tell mine. For different reasons. Somebody might say, well, you didn't deserve to be where you are. You didn't deserve to have what you have. So anybody that's been in my corner that has pushed me forward and said, I know they said you couldn't do it, but you can, and you are doing it, and I see you in a better light.
Yeah. Most definitely. How about you?
So if I think back, I think the push that I had, someone that was really important to me was my grandmother. She lived in a elderly community, like a high rise, where there was, a lot of elder people. So when I spent time with her, that is who I saw, her neighbors, they did activities. So I think my love for specifically the elderly community started there. So once I finished high school, I said, oh, what do I want to do? And nursing has always been that's always been the thing for me. A little bit of my story, I had my children really young. And so when I started college, I had my first son right out of high school. So, starting school, having to take a break and things like that, I think what kept me motivated to keep going, though, and keep working towards, because it was hard, being a single mother and raising children. What motivated me were my children.
Yeah.
So.
Yeah. Most definitely, man. Yeah. So, growing up and seeing those elderly people in the community that your grandmother lived in, right? So I know that actually, that touched me too. I had a real good relationship with my grandmother, and once she fell sick and just having to help and assist with her, you know what I mean? So I know how that can really, really touch you and spark a fire inside of you. You know what I mean?
Right.
Yeah, that's dope, man.
Yeah,
that's
my
dope.
grandmother really instilled in me that I could do anything when maybe the environment or the community that I actually grew up in didn't really push that as hard. So.
I can relate to that for sure. What would you guys like to share with the listeners about Nu Leif? What that we haven't touched on?
That's a good question.
Besides that, it's an amazing establishment that I feel that you guys should be enrolling. If you're interested in becoming a CNA, you need CPR classes, you need to enroll here.
Absolutely.
Yeah.
And if you know anybody that needs personal in-home care, send them our way.
Yeah.
For sure.
Yeah.
Because we're very passionate about that. Seeing our community taken care of. The elderly clients, they're staying home more now. Some people opt to do nursing homes, and that's okay.
Yeah.
You have to go with what's best for your situation. But we are here, and we're not doing anything any different than anybody else is doing, but the quality of it is much different because of our experience, because of our passions, because we see our own loved ones that need this type of help, as well as we started out as CNAs, and we know how it's impacted our nursing career, how being a CNA first affected our bedside manner, knowing how to talk to people, knowing how to interact with others. And so come to us, come to Nu Leif. I mean, we're the place to be.
Yeah.
Yeah.
And I just want to point out, if you know anybody in the community, your loved ones need some assistance in the home, you're trying to keep them in the home longer, give us a call, 501-904-1816.
1816.
Also, our CNA program is currently enrolling. If you need some assistance with that, you can check out the Little Workforce Center, the WIOA program, TANF, T recipients. Also check out Our House Community Center. Get over there with them. We're affiliated with them, and also Arkansas Rehabilitation Services.
Okay. What's the social media? How can they find y'all on Facebook, Instagram?
It's just Nu Leif Logistics. Yeah.
On Facebook and Instagram. Nu Leif Logistics, absolutely.
Okay, that's what's up, man. I really appreciate you guys. I really do. Like I said, y'all, this is a beautiful establishment, man, and I feel like it's an amazing program. Anyone looking to get into this field, contact Nu Leif. I'm telling you, it's the place to be. Yeah. And thank you, guys.
Thank you.
Wish y'all well on all your future endeavors.
Thank you.
Absolutely.
Thank you for having us
We
on the
appreciate that.
podcast.
And thank y'all for taking time out y'all schedule. I appreciate it.
Absolutely.
365, Nu Leif. Wake up. 365.